Every patient, every question, every cold, every pain, every tooth, every gum, every flinch, every worry, every flu, every ache, every age, every breath, every treatment, every learning, every accreditation, every clench, every gargle, every tear, every smile, every day, every week, every month, you show up. It's what you do, expertly. And at Haleon, we're with you. As a partner with proven products and professional development, Haleon, for health with humanity.
Ladies and gentlemen, I'm Nadim Abu Jawdi from Lebanon. I'd like to welcome you to the World Oral Health Day, supported by Haleon, global partner of the FDI and World Oral Health Day. Haleon is the producer of Sensodyne and Parodontax. We start with the welcome speech from Dr. Greg Chadwick, President of the FDI.
Haleon and FDI have joined together for the second year in a row to enhance oral health literacy and awareness across the globe. It's essential that everyone has access to high-quality oral health care and the knowledge required to maintain a healthy mouth. That's why every year on March the 20th, we urge the world to unite to raise awareness about the significant role good oral health and a healthy mouth play in protecting overall health and well-being. This year is particularly special as we kick off a new 3-year campaign with the theme, A Happy Mouth Is. In 2024, our focus is on emphasizing the important connection between oral health and general health, with the message, A Happy Mouth is a Happy Body. On this exciting new journey, Toothy, FDI's beloved oral health mascot, takes center stage, leading the way in an action-packed, movie-inspired campaign which aims to mobilize as many people as possible. On this note, I encourage you to amplify the star's social media debut on Instagram and join his exciting adventures. As a focal point for the campaign, Toothy will play a vital role in promoting awareness about the intricate connection between oral health and well-being throughout the campaign period. Historically, the mouth and oral health have often been overlooked in the broader context of general health. However, compelling evidence now underscores the pivotal role oral health plays in maintaining health and well-being. Additionally, with recent developments in the global oral health landscape, with the adoption of the World Health Organization's resolution, strategy, and action plan on oral health, we're seeing a growing emphasis on integrating oral health within general health. The ultimate goal is achieving universal health coverage, emphasizing a comprehensive and inclusive approach to health care. Despite progress, many inequalities persist in oral health, both within and between countries. While oral diseases are preventable, their global burden remains unacceptably high. Underprivileged populations bear a disproportionate burden, facing barriers to make affordable and appropriate care inaccessible to many. World Oral Health Day serves as a powerful opportunity to unite and amplify our voices, urging governments to take decisive action. Through collaborative efforts, we have the power to enhance the well-being of individuals worldwide, ensuring a happy mouth and a happy body for all.
Thank you, Dr. Greg, for this introduction. Today, we'll be talking about happy mouth, happy body. Definitely, we know that the oral care is very important in the systemic medical health. We have with us many speakers who will address this topic. We start with a presentation about dental hypersensitivity, where I would explain the mechanism and the implications or different type of hypersensitivity. Then Dr. Rasha Ahmed will follow and explain the mechanism in depth of the hypersensitivity and the ways of treatment. Later on, Dr. Karine Tabarani will talk about cardiovascular patients and the periodontal situation. Later, followed by Mrs. Yasmin Arafsha, who is a hygienist, and the role of the hygienist in preventing complications in pregnant women. And we'll close the session with Professor Hisham Mir'i, who will talk about diabetes and the periodontal situation. At the end of the presentations, we will be happy to have a panel discussion with the 4 eminent speakers about the topics that have been discussed earlier. And this session also is supported by Haleon, the producer of Sensodyne and Parodontax. Let's go to the first presentation. Ladies and gentlemen, my name is Nadim Abu Jawdi. I'm a prosthodontist from Lebanon. I am a clinical associate at the American University of Beirut. I'm a senior lecturer at the Lebanese University at the postgraduate department of prosthodontics. Today, we'll be discussing the dentin hypersensitivity, and is it an obvious condition, silent disease? This presentation outline will talk about tooth anatomy, we'll have the definition of the hypersensitivity, and what are the types of hypersensitivity and the related causes, and then we'll have a treatment protocol. The tooth is a structure that is divided in 3 parts: the crown and the core of the tooth and the roots of the tooth. This is embedded in bone, where it is covered by the gingiva, and you have the vascular nerve packet that goes in, and this is the part that is responsible of the sensitivity of the hypersensitivity, as it is called. Hypersensitivity is a mechanism that is being described in the early 1900s by Gysi, and where he's elaborated the theory of hydrodynamic movement of the fluids in the dentine. And these hydrodynamic movements will have pressures on the odontoblast terminations that will indicate the sensitivity. But the hypersensitivity is the higher response of these odontoblasts to this excitation and dynamic movements of the fluids. So exposure of the dentine will lead to the dynamic fluid movement, which is by itself giving us the hypersensitivity. Hydrodynamic movement of the fluids will lead to this hypersensitivity, and which is exacerbation of the response to the stimulation. And what protects the tooth from this hypersensitivity? Actually, the enamel is the hardest material in the body that covers basically the tooth all the way to the gingiva, to the sulcus, and protects the tooth from the hypersensitivity. When the dentine is exposed, due to many factors, whether they are mechanical or chemical, it will expose the dental tubules, and in the dental tubules, you will have the movement of the fluids, and this movement of the fluids will implicate the dentin either sensitivity or when it's exacerbated into a dental hypersensitivity. And according to many studies, this has shown that the food hygiene and the mechanical cleaning have a major direct role in reducing the thickness of the enamel and exposing the dentine, thus creating the problem. And what are the supportive products like Sensodyne do? they try to remineralize and try to block the tubules, dental tubules. But is it a silent problem? Definitely not. According to the statistics, and this is one of the statistics of the Arab world, we have 62% of patients complaining of hypersensitivity. Actually, at the Lebanese Department of Prevention, we are seeing more and more now young patients complaining of hypersensitivity, and all this is due to the hygiene of food hygiene and lifestyle, like carbonated drinks and heavy sugar that are in the regimen of food. This is not only in the Arab world. You can see that many studies in Turkey, in Europe, in Nigeria, in Tanzania, and in Pakistan, these are only samples of countries that have given us the statistics of hypersensitivity, ranging from 30% of the population up to 56 to 60% of the population, as we have seen in the Arab countries. But the type of hypersensitivity is not only one type. We are not addressing only one type. There is a hyper response to cold stimulation. Also, patients could complain from stimulation or hypersensitivity to hot, and also chemical stimulation, which is sugar or acids, and then the chewing stimulation. And all these are hypersensitivities. So hypersensitivity is not only one topic to be discussed. Let's take the cold stimulation. In the cold stimulation, we have two types of stimulation, or patients complaining of hypersensitivity. Whether it's a sharp, quick response and quick relief, and it is very important, it's a quick relief in this situation. Or is it a sharp, long, and increasing with time hypersensitivity and complaint. And this is a different type of hypersensitivity and different causes. Look at this case. This is a case of sharp, quick response to cold, even to air. It is due to what? It's due mainly to mechanical abrasion with the over-treatment, overdoing with the brushing. So we have two problems mainly. Lack of brushing and lack of hygiene, and over-brushing that is leading to gum recessions and dentinal exposure, leading to hypersensitivity. This type of hypersensitivity could be treated by blocking mechanically or chemically with the open dental tubules with desensitizing agents, whether it is fluoride in different chemical presentations, whether it's a fluoride ions or stannous fluoride, or also by desensitizing it with the potassium ions. And all this to reduce the response of the hypersensitivity. And you can use these kind of products. It is a leading company that give us the product to block with Sensodyne the dental tubules with the fluoride. But this kind of problem also could be treated mechanically and surgically. Surgically by bringing down the gingiva to cover, if it is indicated, in the cases where it is indicated, we can use coronally displaced flap to cover the root exposure. And what is not covered in the root exposure could be also mechanically covered by composites, and this would be the topic of one of the following presentations during the year. Response to cold. If it is increasing with time, the patient would drink something cold, and then the pain does not relieve immediately, but it increases, and it increases for a couple of minutes. it is not anymore a dentinal hypersensitivity. It is a pulpal hypersensitivity. We have, before indicating desensitizing agents, we have to rule out the possibility of decay reaching to the pulp and giving us the problem of increasing response to cold that does not reduce immediately. Hot stimulation. Hot stimulation is not it is a hypersensitivity to hot and not to cold. And it is induced by an empty canal, empty pulp chamber, and it is the sign of a pulp necrosis that should be treated by a fill up of the root canal, proper root canal treatment that has to be done for this case. And then you can see on this X-ray that this patient was reacting to hot and cold because he had on the second premolar an empty necrotic pulp, and on the adjacent teeth, the first premolar and the first molar cavities that are responsive to cold, sharp and quick response because of the decay that is there. When we talk about the chemical stimulation we have many. On these many chemical stimulations, we start with the sugar. Sugar is a calamity nowadays. It's a problem because all our kids' meals are full of and hypersaturated with sugar, whether their meals or their drinks. The response to sugar is an initiator of the animal decay. Usually, early decay would respond to sugar intakes. Later on, the acids will come and they will attack acids from juices, mainly from juices. And then the carbonated drinks this is a major problem, which is the acids and the carbonated drinks associated with the high sugar concentration in these carbonated drinks that cauterizes the patients and can lead to this kind of generalized decay where the patient do not complain or complain rarely from hypersensitivity because the terminations or the ending of the odontoblasts have been cauterized by these carbonated drinks and intakes. So these are the major problems. It's a calamity and it's a problem. It's a problem especially in the Middle East, because in the Middle East and part of Africa, we have patients who have white spots that are related to fluorosis. And in the presence of these carbonated drinks and high sugar intake, these are the weak points for decay, as you can see on this X-ray for this very young patient who's under orthodontic treatment, or this patient also, another patient who ended up with, stopped the orthodontic treatment because of his bad hygiene, bad oral hygiene, and bad food hygiene. And we stopped all this. Sensodyne could help us in these situations with the fluoride that is inside these products. But also when patients do come and complain about hypersensitivity on biting, it is very important to check that we have two types of problems. Whether it is abrasion due to the clenching and grinding, and if it is on regular food or on hard food. If it's on regular food, usually it is because of the abrasion that is happening. And on regular food, in the presence of an acid, for example, with a salad or a tabbouleh, you'll have the acid, the citric acid that is cleaning up the dentine, and comes the burgle on the occlusion and gives you hypersensitivity. And here we have to make sure that we have to treat these bruxing patients in a proper way. Or if you have opposing ceramics, opposing natural teeth, you have tooth abrasion that will lead to hypersensitivity on chewing. But the other type of hypersensitivity also is from hard food, and it is the crack formation on the teeth, as you can see on the X-ray. And this is very common, that can lead to a very deep crack that can reach the pulp. And these kind of cracks are very well detected and very well described. When your patient bites on Q-tip, put the Q-tip on the cusp, ask the patient to bite on it. he will feel some sensitivity, but on opening, on relieving the stress, the sensitivity is higher. This is the indication of a crack. And this crack, you have to monitor it and check it if it is going to the pulp or going deep into the periodontium. As you're going to see here, this one is going to the pulp. It led to the pulp necrosis. But on this case, you can see on the mesial aspect of the mesiobuccal root, the mesial crack, and then that led to the extraction of the stools. And you can see on the second molar, a mesial crack is developing, and this is developing quickly after the extraction of the first molar that led to the extraction of the second molar. And it is very clear how it also involved the periodontium all the way almost to the tip of the mesiobuccal root. And studies have indicated that if the patient complains of hypersensitivity, if the patient complains of hypersensitivity, first of all, we go into screening. Screening to eliminate decay and other situations. And if there is no explication for this hypersensitivity except for air response, then we have to confirm that it is a dentine hypersensitivity that could be treated by desensitizing agents and fluoridation and fluoride usage like Sensodyne. And here we have to review the patient every 4 to 6 weeks to check if this part of the treatment is being helpful for him, and definitely indicate to him a healthy brushing, a healthy food hygiene that will also help a lot in this type of treatment. And it is very important to point out that many of the patients who do not complain about hypersensitivity are patients who are silent patients who have hypersensitivity, but take it as a condition that is acceptable for them. We as operators, as dentists, as oral hygienists, we need to ask these patients, because according to studies, it has shown that there are 40% at least of silent, non-disclosing patients who have hypersensitivity, but consider that this hypersensitivity is a regular thing in their life, and they do not approach the dentist or the medical team for this problem. So the medical team has the responsibility of pointing out to these patients that and screen them for eventual silent hypersensitivity. And you're going to tell me, how come hypersensitivity and silent? Hypersensitivity is a pain. Yes, it's excruciating pain. But it could be, according to different patients, the level of tolerance of patients is different. And that's why they consider it sometimes, or most of the times, acceptable for them, and they do not mention it to the operator. And here is the importance of mentioning it or screening it, looking for them and declaring them, and help them to have a better life. And in the treatment protocol, I would conclude that the visit to the doctor, to the dentist, or to the oral health care provider is very important to assess the origin of the hypersensitivity. And then this oral health care provider should indicate for the patient the appropriate approach, whether it is appropriate brushing with a soft brush or the appropriate technique with the soft hand, because many patients use soft brush, but they have a very harsh technique in cleaning. If need be, and ruled out all the pathologies, desensitizing agents and toothpaste, like the supporting toothpaste Sensodyne for this event. Avoid acidic food. So it's a hygiene in the oral food intake, whether it is acidic or sweet beverages. Fluoridation, fluoride for the young patients, desensitizing and bonding, and to initiate a healthy style of life as early as possible. So the responsibility is to teach our kids how to have a healthy style of life. And definitely it's the responsibility of the guardians, the parents, the dentists, the hygienists, the oral health care community, and awareness followed by guidance and application is the key to the treatment of our patients. So obvious condition or silent disease, dentin hypersensitivity is there. Thank you, Haleon, for supporting this event.